Hi guys! Alright, in this video today, I will get back to my Pilates routine with you, and I will start by talking a little bit about my Pilates journey, why I stopped and why I am restarting right now, and what is going to be different between my previous Pilates way of teaching and what I'm going to be offering to you now. Now, first and foremost, I am only going to teach mat Pilates, and most of them will try to avoid props unless necessary for your body type because something is uncomfortable or something hurts. Now, the reason for that is because I tried, I'm certified in everything, uh, barrels, chairs, Cadillac, reformer, Pilates, and of course mat. And what happened was when I was working out with the apparatuses, I I was gaining a lot of muscle. It was an amazing thing visually to observe, right? All of my muscle and my tonus, but it was not, it did not feel good in my body. It felt that my body was too tense. And most of the time, I would get a lot of pain right here in my quads. Now, I've tried changing everything to get rid of that pain, that terrible pain in my quads. I've incorporated another method, a method of a very famous choreographer, Russian choreographer, whose moves are very similar to Pilates. I believe that Joe Pilates borrowed a lot of those moves from the guy and brought them into what he built as Pilates method. And when I incorporated those moves, most of them required you to do everything in a turnout, because how it turns out to be, all the dancers are facing a very similar issue with overworking the quads, right? And not having enough balance in between the quad and the inner thigh, outer thigh, and the hamstring, which is in the back of your leg. So everything, when you turn your feet out and you do everything in a turnout, you take the pressure off the quad and you work mostly your inner thigh at that point, inner and outer thigh. So I tried doing that and it worked for a little bit, and then the problems continued. Meanwhile, I was teaching a lot. I had a lot of clients at home. I was also working in a beautiful studio in Beverly Hills with Maria Leone, who is also my master teacher. She is the one that I got certified with for everything. And basically, what started happening, I started all of a sudden getting a wave of clients with Ehlers-Danlos syndrome. And if you don't know what that is, when people are hyperflexible, when people are hyperflexible, when they are, when they have their limbs that can bend all sorts of ways. And it is very hard to build muscle on those types of bodies because of the way the muscle fibers spin and build, not muscle fibers, the way the collagen is being built, is being produced in those types of bodies is very different than in, let's say, my body, right? So I started researching Ehlers-Danlos because all of a sudden I got a ton of clients with Ehlers-Danlos, and I was very interested in it, and I was very interested in trying to understand, because some of the ladies that I've worked with, they're literally like, we would work together and their shoulders will pop out, and one lady was very severely on the spectrum. It's a spectrum of Ehlers-Danlos. You can be hypermobile, or you can be Ehlers-Danlos, which is the end of that spectrum. Now, хорошая собака. Now, what ended up happening with her, she would have things pop out when we're working out. Sorry, honeychko, I'm just trying to make this video, baby. Okay? Is that okay with you? Go to the couch. Иди на диван. Иди на диванчик. No, it's not gonna happen. Okay, ты хорошая собака. Okay, go. Let's go. Хорош. Alright, so I don't know if that's gonna happen or not, but I'm glad that we're friends. She's being extra close right now. Alright, so she would have things pop out. Even her vertebral column would, some vertebra would misalign, and she would have to realign them. Very interesting stuff. But for us to build muscle on her, it was a completely different story. It was so challenging, She would not get any muscle mass, gain any muscle mass. For us, it was more about stabilizing her bones and building little tiny inside muscles slowly, by literally doing tiny exercises, holding the core, breathing without sudden movements and stuff. So as I was researching that, I've noticed something about myself. I've noticed that I actually am known since childhood to develop muscle quickly. So I can exercise one day, 2 days. On the third day, you will see muscle definition on me. Now, that said, I've always had this quad issue, and believe me, I went and I've researched what can be weak to have my quad, what other things besides the imbalance between the back of the thigh, outer thigh, inner thigh, and the front of the thigh, how to balance that, and then what else can possibly be wrong for the muscles to hurt so much. And that included, working on all the hip flexors, hip extensors, strengthening them, and going deeper and deeper inside the muscle mass, and figuring out all the little ones that can potentially have this effect of overworked quads. And nothing worked. But then I also remembered one more thing, comparing myself to someone who's on the spectrum of hypermobility. And again, I say it's a spectrum, right? And then I realized that I scar funny. Every scar that I ever get in my life, it's a keloid scar. When I had my breast implants done, I actually had to have surgery 5 times because I kept getting capsular contracture, which is when the scar tissue forms too hard around the implant. The body is overprotecting itself, and it doesn't allow the implant to drop. So the implant will stay lifted, one breast will stay lifted, and one breast will stay lifted, and the other breast will drop, so they become uneven. And then, so I kept getting capsular contracture on different breasts. And, my history with keloid scars, my capsular contracture, my pain in the muscles, sharp pain in the quad all the time. I even used sound therapy to try to get rid of this pain. I've done everything, and just it wasn't letting go. I was trying to shoot videos for you guys, and I would go through the routine, and all of a sudden I would spasm from pain in the quad. So I decided among other reasons, to just take a clean break and see if my body changes, if my body stops acting this way. And I left Pilates for a year. I stopped doing it. My body actually feels amazing. I no longer have pain in my quads or pain in my lower back. Um, Nothing hurts. Nothing hurts. And I'm very, very active. Nevertheless, I hike all the time. I'm a single mom to three boys, and we're very, very active with sports and bikes and paddle boarding. And it's all me, bringing everything to the car, loading, unloading, blowing everything up, and inflating everything, and so forth. So I move around all day. I literally bought my first couch this year. In many, many years, I did not have a couch. I didn't even need to sit down because, I didn't have time to sit down. So I'm very active, although I did not do any specific exercise routine. Um, Within that time, I realized that I must be on the other spectrum of Ehlers-Danlos, right? On the other spectrum of hypermobility. And I also have a frozen hip. My right hip is frozen, so it takes me a lot of work to warm it up and to have it open properly. So all of those put together, it dawned on me that if somebody is hyperflexible, I am hypoflexible. I'm not as flexible, but my body also overproduces collagen. So that's why I scar with keloid scars. And what happens with muscle when I rip the muscle, it repairs itself. That's why it repairs itself too hard, and that's why you can immediately see definition in my muscle after 2-3 times I exercise. But that's why it's so painful, because it's actually collagen tissue overproducing itself, or it's ripping, and anything that's ripped in my body, it heals too strong. So I decided to respect my body, respect the fact that it is this works in this way, and let go of Pilates for now. See how I feel now. As I said, I feel amazing. My body feels amazing. There's a lot of many changes that I have undertaken throughout this time. I have dedicated my life to fully to my children, of course, and also to the forest. I spend most of the time up north. I drive there as soon as the kids go to their dad. I have been foraging, learning plants, learning habitats, environments, how to forage, how to gather things, but also how to take care of the land where I'm gathering things. So this self-sustainability in a way. So I've been busy, but I'm 40, I'm about to turn 41, and when I don't exercise at all, things start falling down, right? And I do have now, I've gained some weight. I do have some cellulite now. I have, expanded. My hips got bigger. Everything around got bigger. I actually don't fit into clothes that I used to fit when I was back in the day, let's say 1.5 to 2 years ago when I was teaching Pilates. I don't fit into that clothes anymore. I'm half a size to a size bigger, and I'm loving it because I like my curvy body a lot. But I do feel like I can use a little bit of exercise. Now, this is very important, that this exercise routine is not going to be to build any muscle or to make your body beautiful. This exercise will be intended for those who are looking to just be as whole, as wholesome, and as healthy as possible in whatever body that they are. So, no, не надо кусать. So, I will be going in accordance to my body and what feels good to me. So let's now establish the understanding that I am on the opposite end of Ehlers-Danlos, on the opposite end of hypermobility, right? So if you feel that same way, if you've had these similar issues come up, then these classes might be wonderful for you, because we're going to go slow, we're going to go gentle, we're going to do all of the mat exercises, we're not going to skip. Of course, do them as you desire. You don't have to follow anything. Of course, you have to talk to someone like a physical therapist or any sort of professional if you have any injuries, if you're prone to injuries. I recommend that you always treat your body well and first ask your health provider to let you know what is good for your spinal movement and what might be hurting you if you move your spine in a certain way, right? There's flexion, there's extension, there's side bends, and depending on your current state, some things might not be available for your body right now, and you don't want to find out the hard way. I've seen people do go both ways. I've seen people not listen to what their health providers told them and do well, and I've seen people get really, really hurt because their bones couldn't handle certain exercises. So I'm doing this as I would do it, and you do all of your research to see if this is appropriate for your body type. What else can I say? I think it is very important to mention that I do not drink, I do not smoke, I do not do any drugs, I do not take any pills, any over-the-counter medicine ever. There is one time every 4 months I get a pain. This happened after both of my C-sections. I get a pain that is intolerable. So during that time, especially when the kids are around and it's just me, and I get this pain that I can't really walk or move. It's on the lower tummy. Then I take half an aspirin to numb the pain so that I can continue being a mom and not scare the kids, because the pain is so severe that I can't walk, I can't breathe, I'm laying down. As soon as it starts, it just drops me to the floor, and it lasts. If I don't take the aspirin, it can last for, I don't know, it can last for like an hour or so, and it's excruciating pain. So that's the only time that I would say take medicine like that. And I therefore trust my body to not break during these exercises, because I know that I have healthy tissues inside. I have healthy bones, I have healthy skin, I have healthy blood. It was an effort to get here. I used to do everything. I used to smoke a pack a day. I used to drink a lot. I used to even do some recreational drugs. And it was all a part of this package of getting back to life, to the real magical life, to the real pure life that can be. It was all a part of me getting to that by quitting all of those things. And we can always talk about that. If you struggle with any of that, please put it in the comments. I am not against people who are doing it. I just know that these exercises might be a little too much to ask of your body if you're also smoking and drinking. I've worked with so many clients, and I also I teach clinical Pilates, so I worked with a lot of people who are post injuries and just health issues. But I've seen people who don't smoke and people who do smoke. And I've seen people who do smoke. They literally they turn their head and something just is what do you call it, cracks, and they're then out of commission for a while, or they do an exercise, something simple, maybe they're not doing it exactly right because they haven't learned how to engage in the core just yet, and their vertebral column, their vertebra cracks or something. And in my experience, it happens mostly to people who are on prescribed medications, who are smokers, who are drinkers, or especially to the ones who do all of the above. So if you are at that stage in your journey, please consider getting rid of those first, and then adding Pilates to that on top, to when you already recover from those addictions. And again, as I said, I was there myself. I hold no judgment. I just know what I'm talking about. So please go ahead and reach out to me if you're struggling with something like that, and I'll tell you how I did it, how I let go of those things, how I successfully came out on top of all of those monstrous egregores, monstrous entities, as some would call, that were holding me hostage. One more thing that I forgot to mention when I was still doing Pilates heavily, I had one of my friends. She's an incredible Pilates teacher. She came to give me a massage, and she touched my stomach, and she said that you have overworked your core so much. You are so tense there. She's like, and Pilates and yoga are a little bit different in this way, because in Pilates, we don't breathe into the stomach. In yoga, you do breathe into the stomach. In Pilates, we breathe into the lateral rib cage. It's called lateral rib cage breathing. So we expand here, keeping our tummy always tight. In yoga, you breathe all the way into the tummy and back out, right? So she told me that, listen, it's not because I don't like Pilates, but she said, you need to relax your stomach. You need to relax your body. And first, of course, I didn't want to hear any of that because I was so good at what I do, and so well built at that time. Although something didn't feel right, I was like, well, I look good, I know I'm doing what I'm supposed to do, I'm going according to all the Pilates plan, right? So what is she saying to me? But after she left, she's also a healer. She worked on my stomach. After she left, about a week after, I stopped teaching, because the process has begun. She has done something with my core to start loosening it up, and I went on to several cleanses afterwards, like a juice cleanse, and certain things have entered my life that I didn't think were were going to, because I had different plans, but apparently universe had these plans for me. Plans to stop exercising and to relax, to learn how to relax, because it wasn't going anywhere good with me constantly being in so much tension with so much muscle on me, so much muscle tone. Now, long story short, here we are. I am starting to exercise again. I'm starting to exercise slowly. I'm starting to exercise gently. However, I'm doing all of the good stuff, the entire Pilates routine, which we will learn from you with you as we go. And again, I don't think that muscle is natural. I can't stress that enough. I don't think that muscle is natural for the body. I think muscle is just shows that some of the tissues are overworking, that the fascia is possibly dehydrated, that it can show so much muscle through. I'm not after muscle. I'm not after that. I'm after feeling great, and in these videos, and being gentle and respectful towards the body. So in these videos, I'm going to teach you my way of doing Pilates, very gentle way, yet very educational. We're gonna, work the entire body, starting from the core and moving outward. And I will also teach you about my cleanses, what I do, about my fasting, my intermittent fasting, and my dry fasting, how I juice. We're going to talk a lot about all of that, and then also just about everything that comes to me from the inner realms, which are sometimes inspirational messages that someone needs to hear. I call it cardless tarot. Sometimes these revelations, messages, images just come to me, and I used to think that they're just for me, but I know now that they are for me to share with you, and for you to get them at the right time. So that will be a part of the package of this transmission, of this channel. All of those things: Pilates, nutrition, things about things that might seem somewhat esoteric, that come to me through my these visions and revelations and these insights that I will share with you. What else are we gonna do? We're gonna walk around the forest gathering mushrooms. I'll teach you how to forage. And what else? And that's it. Everything that comes along with my daily life, I will gladly share with you, to create a community, to create a connection, and to create the healthiest beings from ourselves that we can possibly create in this lifetime, to really enjoy being, enjoy the energy that is available to us, that sometimes is not able to pass through because of all the blockages. We're gonna unblock, release, let go, and do it gently, do it with lots of love for ourselves, and learn how to thrive, but thrive in relaxation, not thrive in wanting to be strong and powerful and muscular. We'll allow the divine feminine to lead us today. All right, today and tomorrow, and maybe every day. but then we would be imbalanced, right? So there is a place for masculine, but maybe sometimes he'll come for these classes as well. But as of now, I want this to be a very gentle, intuitive way of moving for all of us. So please join in and enjoy the class.